Hi, I'm Kate Gibson. My pronouns are she, her, and I'll be providing today's crisis intervention training. First of all, thank you for joining me. I know this is a sensitive topic, and so I do want to start off by saying if you are in a vulnerable state or if this is going to bring up recent events that you've experienced, I would recommend holding off to take this training until a later date. The only other thing that I would mention is we also have a handout for this training that you should have access to, and it will have all of the stats and figures that I'm using, as well as all of the listed references and resources that I got my information from. So you can feel free to look those up for yourself if you want more information or you need clarification on any facts or figures that I've listed here. So having said that, let's go ahead and get started. So for today's training, we will be covering suicide prevention and response. We will also dig into the rates of suicide, some of the scope of the problem, both within the world at large and the United States specifically. We'll also then cover crisis intervention, including some steps on how you can help someone if you notice someone is experiencing a crisis. From there, we'll go on to assessing someone in crisis for trauma exposure and also for abuse or neglect. And then finally, we will end with some recommended treatment options to follow up with that have been known to show good results for both suicidal and homicidal ideation. So we start with suicide prevention and response. Approximately 727,000 people die each year by suicide around the world. And 73% of those suicides occur outside high-income nations. That means they're happening in what are considered low and middle-income countries. That means this is not just a problem for a small portion of the world. This is a problem for everyone. And one thing to take note of is nearly 20% worldwide of suicides involve the use of toxic pesticides. But if we go more specific and we look just within the United States, approximately 49,000 people are dying each year by suicide. And there are certain categories of demographics that are facing higher risk and higher rates of suicide within those. Currently, Native American and Native Alaskan populations are showing a higher rate. They're also showing that men are more likely to die by suicide than women. And senior citizens that are ages 85 or older are experiencing higher rates of suicide. One of the populations that you might expect to see here that I was expecting and did not find would be the LGBTQ plus population. I don't know if that is because of recent administration changes from the sites that I was getting my information from, but I would still want to mention them because I know historically members of the LGBTQ plus community have experienced higher rates of suicide and have been at higher risk, which is why they have some of their own dedicated hotlines, warm lines, support chats, and all kinds of resources specific to that. So that is something that is not listed in the information provided, but I did want to give a mention to that anyway. And one thing that was listed that I took note of was that firearms were the method used in over 50% of suicides in the United States. That surprised me, even though the United States is known throughout the world for having higher rates of gun ownership. I was still surprised that over 50% of suicides involved a firearm. And suicide was the second leading cause of death in the United States for people ages 10 to 34 in one of the recent years that I was getting numbers from. So the numbers were primarily from 2023 and 2024, and it was the second leading cause of death in people 10 to 34. That's a significant problem. That's a crisis. So one of the areas that I found resources from was the CDC. And I want to show one of their short video clips to give us an idea of some of the strategies that they have been coming up with as a response. So we're going to go ahead and play that.
Why? Every time a suicide happens, we are left asking, why? The truth is, we often can't narrow it down to just one single why. But it's also true that there are many ways forward. When it comes to reducing the rate of suicide in our communities, CDC has identified key strategies we can take to prevent suicide. These science-backed strategies include creating strong financial and environmental conditions by building up economic supports, stable housing, and communities, by reducing access to lethal means among people at risk, and boosting access to care and social connections, by teaching coping and problem-solving skills through learning and educational programs, and providing support for individuals and survivors by responding to and following up after a crisis. When it comes to suicide, there's more than just one why. And when it comes to suicide prevention, there's more than just one way. There are many ways we can work together to apply these strategies and prevent suicide. To learn more about strategies for comprehensive suicide prevention, go to cdc.gov/suicide/prevention.
All right. So one thing I appreciate about that video is I do not typically think of stable housing or increased healthcare coverage as a suicide prevention tool. When I think of suicide prevention, I often think of wristbands. I think of a month of mental health awareness. I think of people who have lost loved ones who go and become speakers to advocate against suicide. But I really appreciated the multi-level approach that the CDC was taking, not just from a national or an international level, but also something as specific as a local community having more access. So some of these strategies that we're looking at here are stabilized housing and financial security. This is crucial when you think about somebody who is struggling to know where they're going to live, who is struggling to know where they're going to work, who doesn't know if they can afford to buy food for their children. That's going to add a ton to their mental stress, and that could push them over the edge if that's another factor in a building cascade of events. Another thing they mentioned was covering mental health care in healthcare coverage. That is still a relatively new result in the United States after Obamacare came in and made that part of insurance plans. And it has really been astounding to see the ways that was brought in, especially during COVID, tying into increasing the mental health care to underserved and remote areas, because COVID brought in telehealth much more prominently than it had been in the past. And that was a huge gain as far as preventing suicide. Another area, kind of tying back to what we talked about earlier, about 50% of suicides in the US being tied to a firearm, is reducing access to lethal means, specifically to those at higher risk. When you live in an area where it is easier to buy a gun than it is to get access to crisis services, you're going to be at higher risk. And so having more access to healthcare, more access to crisis support, a little bit less access to immediate lethal means when you are in that vulnerable state can do a huge amount of prevention work for us right there. Tied to that as well is encouraging healthier social norms so that people are not afraid or ashamed to take advantage of these services. If the mainstream society decides that having a mental health condition or being a trauma survivor or going through a mental health crisis is a stigma or makes you weak or makes you undesirable or makes you someone that nobody wants to be around, then people are less likely to take advantage of these services, even if they are offered in these remote areas. So it's important that we're encouraging healthier social norms, because as a society, that pushes us forward where people are able to get the help that they need. And part of that is teaching social emotional learning to both children and their parents, because when children are going home and they have emotional support from their parents, and then they're going to school and all of their peers are getting that social emotional support and learning, they are less likely to be bullies, they are less likely to be bullying other children, and they are less likely to become isolated and be at higher risk for suicide. And finally, reducing substance use generally can also help us prevent suicide rates from rising. So those are some general CDC strategies, but there are also some local resources that are available in my area, which is Danville, Illinois, about 3 hours south of Chicago. And one of those that we rely on a lot around here, because it is more of a remote, underserved area, is that 988 suicide prevention hotline. We use that at many areas when there is no one that's open during crisis times. Another resource would be the Mobile Crisis Response team that is housed at Crosspoint Human Services. They work in conjunction with the hospital and the emergency room to do emergency mental health assessments. So the nice thing is you can either have someone taken to the emergency room and the crisis team will meet them there, or you can call the crisis team to come to where the person is experiencing that crisis, and they will show up. I believe it's within half an hour to an hour. That's a huge resource for us as far as getting people through a crisis. And because the best way to intervene with a crisis is to prevent it from occurring, the Vermilion County 708 Mental Health Board does offer free mental health first aid trainings for both youth and adult. And those are provided to the general public, but also to area providers, which is a huge benefit and saves a lot of costs when you consider how many crises they are preventing and how many more people they are enabling to help with this problem. So now that I have said the word crisis so many times, it probably doesn't sound like a real word anymore. We're going to talk specifically about what a crisis is. We haven't really defined it outside of suicidal or homicidal ideation. And so I found a video that I believe does a really good job of breaking down not just what a mental health crisis is, but also how everyone can help someone who's going through that. So let's watch this.
I never thought my daughter would go through something like this. I wish I could have known earlier, or at least known that she was suffering.
When my coworker didn't show up last week, I was worried. I'm so glad I gave him a call because he was actually going through a really hard time.
My friend got laid off from his job. He was very upset, worried. He hasn't slept in days. When he opened the door, he started saying bizarre things about people watching him through the television. He kept grabbing his hair and ears. I saw he needed help.
A mental health crisis is when a person's emotional or mental state puts them or someone else in danger and/or prevents them from being able to care for themselves or function effectively in the community. It may occur when mental health symptoms worsen and remain untreated. There are certain signs that may help you identify if an individual may be experiencing a mental health crisis. Some examples are neglect of personal hygiene, dramatic changes in sleep habits such as sleeping more often or not sleeping well, significant weight gain or loss, decline in performance at work or school, pronounced changes in mood such as irritability, anger, nervousness or sadness, withdrawal from routine activities and relationships, expresses no sense of purpose in life, acting impulsively, paranoia, hearing and seeing things that others do not making sense. If someone you know is experiencing a mental health crisis, there are ways to help. Reach out and arrange to talk to them in a private setting. Ask non-judgmental, open-ended questions that show you genuinely care about what they are going through. Avoid jumping in with advice or your own personal experiences. In most conversations, many of us are used to listening just enough to respond and can get focused on our own responses. Listen to understand, not just to respond. Stay calm and focus on the present moment. When someone is experiencing a mental health crisis, it's crucial to ask very direct questions. For example, have you thought about getting help? Talk about safety planning and identify what needs to be done to keep the person safe. Don't leave someone who is experiencing a mental health crisis alone. If they are resistant to seeking help and are a danger to themselves or someone else, call 911. People who are in emotional distress can also call 1-800-273-TALK 8255 or text the crisis text line. Trained crisis workers are available to talk 24 hours a day, 7 days a week. Supporting someone through a mental health crisis can be stressful, but knowing ahead of time what signs to look out for and which actions to take can enable you to be prepared and feel more confident about helping. Lives can be saved if we all take action to help those in need.
All right, as you saw in the video, there are quite a few things that you can do without being a mental health professional. But the bottom line is show up and don't leave until you know they're safe. As a mental health professional, as people in the mental health field, there are more specific ways we can walk someone through a crisis. And so the next slide, we're going to talk through those different steps that are taken from the work of Dr. James and have been widely used in crisis intervention around the world. The first step, which you might think is a little obvious, maybe doesn't even seem to belong there, is define the problem. But when you consider how can you help if you don't know what the problem is, it really is important not to skip that first step. Once you know what the problem is, then it's time to ensure the client's safety. This could be something as immediate as removing any sharp objects like knives or lethal means like firearms from the area, or it could be as simple as making sure that you are not in the middle of a roadway while you're having this conversation. It really depends on the circumstances, but ensuring client safety is right away one of the priorities. Once you've stabilized that enough, you can then go on to provide some support. And this allows you to help remind the person in crisis that they are not alone and they don't have to deal with this crisis alone. It can be helpful to reassure them that there are people who care about them. And even just demonstrating that by your own demeanor and your own sense of calm and sharing that with them can be such a huge, huge thing in the moment. Once you've co-regulated with them well enough that they're able to think through what's going on, you can begin exploring alternatives with them for this scenario. Those could be supports, such as other people in their life that care about them and are willing to help. That could be internal resources, such as their coping mechanisms that they've got that they know how to use. Or it could be helping them walk through the problem and define healthier thinking patterns for the future so this doesn't become a crisis again. Once you've explored some of these alternatives and you've come up with people that they have as supports, you've come up with some coping mechanisms they can use, you've helped define some healthier thinking patterns, then you can begin to work together to make a plan. And this plan should help them be reassured that they don't have to reach this crisis point again. They have steps they can take, they have people they can call, they have skills they can use, they have resources they can access. And finally, once you have that plan, get a commitment from them that they will use it, because the plan is only as good as them actually being willing to use it when they need it. So these are the 6 steps to effective crisis intervention that are generally used worldwide and have been very effective in walking someone through a crisis situation. Now, we're going to shift a little bit here and we're going to talk about assessing for trauma. And you might be wondering, we're already dealing with someone in a crisis. We've already defined the immediate problem. Why do I need to assess them for trauma? That's a good question. So part of the reason is that people that have experienced trauma often respond differently to the current situation than you might expect. Because that trauma lives with them and has come with them through whatever they've experienced, they now have their brain reacting to things in a slightly different way than they might have previous to the trauma. So it's important for that reason. It's also important to distinguish between an underlying mental health disorder and a trauma response. Because when someone has experienced trauma, they may react in a slightly similar way to somebody with a mental health disorder. And knowing the difference between what is going on and where those reactions are coming from can be a huge time saver, but it can also help avoid misunderstandings and miscommunications. So it's important to be able to assess for trauma when you're with someone in crisis. Now, this could be a lot of different things going on. This could be childhood trauma that they grew up with that shaped their personality and their interpersonal patterns of engagement with the relationships. This could be a sudden loss of a loved one or a job. This could be their combat experience still haunting them from years prior. This could be a violent sexual assault that they experienced. It could be a previous suicide attempt that they have not worked through yet. Or it could be an unresolved conflict in their life that is still right there with them every step of the way and is affecting how they interpret what's going on around them. So these are just a few of different ways that trauma could be playing a role in the current crisis that we need to be aware of, and we need to be open to hearing not just how they are right now, but how they got there. Similarly, we also need to assess for abuse and neglect, because again, coming out of abuse and neglect environments can affect your behavioral patterns, your thinking, all kinds of things, and you wouldn't necessarily know that without asking or finding out. So there are different types of abuse and neglect that they may have experienced, and we need to be on the lookout for that as well. This could be childhood abuse and neglect. It could be sexual, it could be physical, it could be emotional. These are all different things they could have survived growing up that have shaped the way that they view the world and the way they interact with the world. But there are also other types they could have experienced that are not related to childhood abuse. They could be suffering from intimate partner violence. They could have had sexual assault experience, or they could have been in an institution. If they've been institutionalized, they could have been abused or neglected there. This could include places like nursing homes, a psych ward, a jail, anywhere that they have been institutionalized. It's possible that that abuse or neglect is shaping the way they view where they are right now and their responses. And one thing that I think is important to mention as well is it could be systemic racism, homophobia, misogyny, transphobia, any of the other isms that we've talked about in the past. Because if you consider the state of racial justice in the United States right now, for example, it may not be a safe de-escalation to a crisis to call 911 and have the police show up if you are dealing with a Black client who has had previous negative experiences with law enforcement. Unfortunately, that could escalate the situation beyond where it's already at. So things like this are very important that we are taking into consideration, that we are thinking through, and that we are responding to and respecting the client's wishes as much as we can when it comes to things like this. This should be something we consider when we are dealing with someone in crisis, because we are only seeing a tiny piece of their whole lived experience. And if all of these other things are built up before that, we need to know as much as we can. So moving forward, there are some recommended treatment options when you get past the initial crisis, or if you're trying to prevent a crisis, specifically regarding suicidal and homicidal ideation. These are two that seem really big and can be really big and scary when you're starting out in mental health work because the stakes are so high. Nobody wants to find out that their client died by suicide or that their client went into their school with a gun and killed some of their classmates. So everybody has a vested interest in making sure they understand what our options are, what's shown good results for these particular symptoms. So when you look at some of the evidence-based approaches that are showing very good results, with suicidality, the top one was dialectic behavior therapy and cognitive behavioral therapy for suicide prevention. So CBT, SP, and DBT. There were also other ones I was not aware before, that there's motivational interviewing for suicidal ideation. But knowing that motivational interviewing can be very effective in other trauma-related scenarios, that was good to know and might be a good resource to have available. When you look over at homicidality, cognitive behavioral therapy, CBT, comes out number one, but there's also dialectical, psychodynamic, and anger management. So there are options for treating a client who comes in and says, I have homicidal and suicidal ideation and I need help. So we have tools, we have skills, we have resources, and these are important to be aware of, because if you've never considered it, at some point you will have a client who comes in with suicidal or homicidal or both ideation. And it is on you as the practitioner to be ready to help and be equipped as best you can. So some of the key takeaways that I would like to leave you with today are that suicide is preventable. Now, this is not in every case. There are areas where we will do everything right and the worst still happens. But the numbers that we are facing right now do not have to be this high. These situations do not have to be this tragic. We do have information, we have tools and skills and resources we can use. We can be part of preventing more suicides. I also wanted to point out that public awareness and just general discussion around normalizing that a lot of people have suicidal ideation can reduce that stigma. If we get to where we have healthier social norms within mainstream culture, more people who are experiencing this ideation will be able to ask for help, and they won't have to feel as isolated or as ashamed because they are having suicidal thoughts or homicidal thoughts. They will be able to get help before it turns into action, before they have a plan. That ties into mental health crises can be resolved without violence. Again, this will not always be the case, but even though it's scary to go in where somebody is threatening to hurt themselves or somebody is threatening to hurt other people, there are ways to show up and to show that we care about the person in crisis that de-escalate the situation and do not end in tragedy. And finally, CBT and DBT are effective modalities for suicidal and homicidal ideation. When your client comes in and finally feels safe enough to tell you what they really have been going through. And that's what this is all about. This is all about showing up. This is about showing that you care. This is about just being that safe, therapeutic space for someone going through one of the worst ordeals in their entire life, to be able to breathe, to be able to calm, to be able to be soothed, and to come back down and handle the current situation. And we have these tools, we have these resources, and we can make a difference in this area. I wanted to thank you for coming to this training today. I put my email address on the last slide if you have any questions, concerns, or just want to do some follow-up discussing of any of the information presented. And I really just want to say that I appreciate your time. I appreciate your energy in this field. And the world needs more people willing to walk into a crisis situation so that it does not become a place where suicide and homicide are the norm. Thank you.